So we're looking into a very specific cohort of people with radiologically isolated syndrome here at the Barlow MS Center in Toronto. And this is a group of patients who come to medical attention because of an MRI scan that looks like that of a person with MS without ever having experienced any typical symptoms. And what we then do is we ask them to participate in our cohort study, and then if they agree, they come once a year. They get neurological examinations done, cognitive testing done, repeat MRIs done, and we also take blood for biomarker studies. And recently at the ACTRIMS forum, I've shared our data on the protein biomarkers. We've oftentimes done studies where we've only looked at one or maybe two of these protein biomarkers, and we found a few interesting things when it comes to a protein called neurofilament light protein, or more recently, clear fibrillary acid protein, and also chitinase 3 like 1. So these were interesting, smaller cohort studies that again looked into single markers. And we thought, well, if we're always going in with a hypothesis that one protein is going to be telling us a lot about these people's future, well, maybe we're missing somewhat the bigger picture. And this is where we ended up saying, well, we would need to move forward and do something that's called multiplexing, basically measuring almost 100 proteins at the same time. And including data from previous studies that where we had imaging and also the single biomarkers, we then created a more complete kind of setup where we were looking into these multiplex biomarkers using a platform that's called Olink. And what we found there was an interesting signature where we saw that when individuals were developing more MRI lesions over time, and also those who developed symptoms over time, well, in that group, we saw an increase of certain inflammatory proteins already at the baseline visit, meaning that proteins such as IL-17 were increased and IL-10 were decreased a year before we saw this radiological activity. So that really means for us that we probably should be looking into immune biology markers in addition to the neurobiology markers that we've studied before. And we're now looking into validating these results in larger cohorts.